Yes, Dr. Liam did my surgery, which was a very complicated surgery on my right foot, and it has come out better than I thought. I can walk on it now. We've got plans to do the second foot next year. I wouldn't go to any other doctor. I mean, he is just absolutely fantastic, and he knows all the ins and outs. So you're in very good hands with Dr. Liam. Thank you.
It looks good.
Yes, it does.
Considering how it started.
I know.
We have to
I've got my before and afters.
we have to take it in perspective what we started with, you know?
It was very bad.
It was very bad, yeah. Very contracted, very bad. I mean, we'll take this result any day.
Yes.
Yeah.
I know.
You had a lot of pain rolling around here, very painful here before.
Yeah.
I mean, I wish this would be a little bit straighter, but that's all your body was going to give me, you know?
Right. Right.
It looks great.
It does.
How do you feel?
I feel great. I do.
Yeah.
I feel really great.
Yeah, you're smiling, you're walking. There's no...
That's right. And then, and then next year I'm gonna have this one done, so it's not as horrible as that one.
Let me see what it looks like on this one.
You wanna see?
Okay. Yeah, let me get a preview.
Okay.
Because this was a revision. I just had to do as much as I could with it. Okay, yeah. So this one we would do this primarily, and then we'll straighten it out so that we don't have scar tissue or everything else. You know, we'll do it correctly.
And then I can straighten all those digits, release those, and
release all the digits here.
Yep.
Like we did over there. But we'll be able to fuse this initially, straight off the bat.
Yeah.
And then do the tendon wrapping. So basically, we took the long extensor tendon over here. We did an old-fashioned procedure because you're putting a lot of weight on here. You're rolling off of here.
Yeah.
This was very,
that's
very,
all
very
I was
painful.
walking on.
She was walking on
very
that.
painful.
And obviously, you can see this is like a hammer toe of the big toe. She had it over here too. So we fused that. As much as her body will allow me to fix at that point with all the scar tissue, we fixed that. It's fused solid, no pain, no movement here.
No.
This tendon right here, you see how she's contracted? She was like that, but worse on this side. We always do the worst side first. It's worse, right? So we took this tendon from here, we rerouted through the bone and tied it upon itself. So it does that for us.
Yeah.
And then we did a very minimally invasive surgery, take away the joint, and straighten this out as best we could on this one. So now she does not have really a lot of pressure here. It's very nice and smooth that she's able to walk without pain.
Exactly.
Great.
Exactly.
Awesome, and release these tendons for you. So sometimes the patient with contracture like to do the least amount possible, and with contractures like this, we try to address. Also, we may address your flat foot on this side too.
I do, yeah. I have flat feet.
We may address it on this side too when we fix you. So that way it decrease the contracture of the tendons going on to here too. So it's better when we have a fresh foot to work with.
I know, and that's what this one's gonna be. So this is my next project.
And we'll get it done, but it looks like you're doing very well, my dear.
Yes.
Let's see you back in 6 months.
Okay.
We'll re-x-ray the right foot in 6 months.